Hello, my name is Dr. Krishna Seshadri. I have with me Dr. Anjana Mohan here. And besides all the things that she does, Anjana is very, very big on physical activity and exercise and how it improves patient outcomes. So I'm going to leave it to you to start this discussion. Being exceptionally fit yourself, talk to us about how can we help our patients become more fit, better, active. But don't make me do exercise.
Wow, you want to be fit without doing any exercise. Just what everyone else wants as well. Jokes apart, I think one of the first things that I wanted to do once I came into practice was that I realized we talk so much about diet and there's so much of focus on it being Indians and all. But I feel along with a prescription, a medicine prescription, and the diet advice that we give, I feel very strongly that we should also give a fitness prescription. And this needs to be individualized for the diabetic patient. Well, it needs to be individualized for everybody, but especially for the diabetic patient, I think something that would really add value is to have the fitness prescription as well that talks about the frequency of exercise, the intensity, the type, the duration, and all of these things that are personalized. And this is something that needs to keep being reviewed with every visit. So I think if we as doctors are able to first believe in this and then convince our patients that it's as important as taking a drug, then I think it'll go a long way in controlling, preventing diabetes.
So one of the things, Anjana, I want to ask you and actually challenge is, a lot of times, we agree with our patients that walking is the best exercise. Mm-hmm. And then for most of us, walking means going in the marina and then ending up at the Chatwala on the side. Now, is walking sufficient? Does it provide sufficient amount of exercise for a diabetic who's probably losing muscle, who's not stretched out? Is walking good exercise? Is that sufficient enough?
Again, this depends on the intensity of the walking that you're doing. If you're doing moderate to vigorous intensity walking, which means that in an hour you're walking a 5 to 6 kilometer kind of pace, then you're probably doing enough. But on average, people who walk about 2 kilometers, 2.5 kilometers an hour. So that's less than half of what's required and is definitely not sufficient. So in the DCLIP study, we showed that we divided people, the very small percentage who actually said that they did walking, and we call them exercisers, and then looked at people who didn't exercise, and we found not much metabolic difference between the two. Mm-hmm. And then, on further kind of investigation, we realized that the intensity of this walking is very insufficient. So anything with a higher intensity by nature, for example, cycling, swimming, dancing, aerobics, etc., especially in a younger population, is definitely walking. See, from not doing anything, yes, it's something. But for those who are walking, those who are older, who find it comfortable, yes, please walk. But you need to keep walking at a particular rate so that your heart rate is up and that you're burning fat and you're getting better metabolic benefit from a stroll is not what we're talking about.
What about rotating exercises? Should people rotate exercises?
Yes, I think that's a good idea because muscles kind of easily adapt. Even in a day or two, you'll find that the weight you were taking yesterday, you could easily do it today, what you were struggling with yesterday. So rotating exercises is really important, and having someone talk to you about this, and maybe a physician is not the best person. You probably need a fitness expert as well to use. So what you need is, along with the aerobic component, you do need muscle strength as well, and you need to keep working different big muscle groups in a rotation. The aerobic is constant, okay? So whatever you do to get your heart rate up and keep it up for about 30 minutes, that's your choice as long as you're doing that. But as far as muscle groups and things, there's a certain way it should be done. Otherwise, you'll tire, you'll get, tolerance and things like that.
So before I go to my last question, I see you're not wearing a wearable. So do you advise wearables to patients? Do you find them as good motivation? If they bring in a wearable report, do you check?
So it's again very, very individualistic, this kind of thing. There are people who wear the wearables and are completely addicted to it and are looking at it, and that's good for that kind of person. And then there's this person who wears the wearable and says, I can't do this. And then that's as well. So it's very, very individualistic in terms of where you want. So there are people who are competitive and want to be in the top 80%, 90%. And for such people, I think the wearables are good. And there are just people who say, I'll meet my 10,000 a day. So as long as you know you're getting what you need to do it, whatever helps you and works for you is good. There's no one
let
solution.
me ask you one last thing. So I'm a 50-plus-year-old man in front of you in your clinic, and this is sort of to help people how to set up an exercise prescription. How would you set a goal for me? How would you give an exercise prescription to me?
Do you have diabetes?
No.
Okay.
But let's assume that I do.
So I would start with how much you're doing already and then build on that. So if it's nothing, I would start with something first, which would probably be your walking. So a small kind of warm up, a 30-minute, active period, and then a small cool down would be my first. And once you've gone to that, then I'll add your strength twice a week. So in India, we definitely need to work on abs and big muscle groups for sarcopenia as well, and then take it from there. If you had diabetes, I would have to do a pre-screening, see that, you go through a medical, finish your certain things before that. Even otherwise, I would probably need to put you through a basic ECG and stuff like that, and then build from there. So the thing about exercise is sustainability. Mm-hmm. And whatever you do has to be sustainable long term when you're talking about NCD prevention or control.
Okay, so that's Anjana for you. Very passionate about this whole thing, and thanks, Anjana. It's been wonderful listening to you.
For more videos, download the Omnicurus app.